afternoon, everyone. Welcome to the Senior Regional Collaboratives Lunch and Learn for today. Our our focus today will be Corktown Health Center. I am Christy King, Association Executive for the Senior Regional Collaborative. We have our technical assistants with Deja Riley, and our presenter from Corktown, today will be Valentina Gelai. So we want to welcome everybody and give you just a little bit of information about who we are as the Senior Regional Collaborative as we work to get started with Corktown and them telling us all about the wonderful work they do. So the collaborative itself is a nonprofit association of government and nonprofit organizations that serve seniors and persons living with disabilities. We provide our member organizations with networking, training, and funding opportunities, helping them to build partnerships and improve the quality of life for older adults and people with disabilities in and throughout Southeast Michigan. Our mission is simple: to improve the quality of life for all older adults and people with disabilities in the region through capacity building and strategic leadership. And we welcome you to join us at any of our events. Diversity, equity, and inclusion is definitely important to us. We value the diversity of every staffer, volunteer, member agency, partner, and representative of the communities we serve. The SRC is inclusive of all the populations and the critical communities that it serves and that we engage with. You can always find more on our diversity, equity, and inclusion messaging on our website. The SRC stands against all instances of social and racial injustices and inequalities. We are committed advocates for human rights and systemic changes, ensuring that the communities we serve can reach their full potential. And always remember, if you want a future that's distinct from the past, you have to be with people who you aren't used to being with and have conversations that you're not used to having. With that, we thank you once again for joining us for our Lunch and Learn today with Corktown Health Center. I'm going to turn it over to Valentina to give us more information about Corktown and the work that they do. Thank you, Valentina.
Thank you, Christy, and thank you for having me here today. I am Valentina Gelai. I use she, her pronouns, and I am the Director of Program Services at Corktown Health Center. I am going to share my slides with all of you. I want to make sure you can see my screen. I just want to double check. Deja, Christy, can you see my screen?
Yes, indeed.
Yes. All right, wonderful. Let's get started. Corktown Health Center is Michigan's first LGBTQ health center. For those of you that don't know, a little bit of history about Corktown Health Center is we grew out of an organization called Health Emergency Lifeline Programs, or and HELP has been providing care and support services to folks living with HIV in the Metro Detroit area for over 30 years. We have been growing since the HIV epidemic started. And with that, we have had to grow and adapt our services due to the advancements of medicine, which is a great thing. So since the beginning of the epidemic, we have had multiple conversations with the community. And back in 2012, we started having a really unique conversation in which the community was starting to share with us that they wanted a medical home. So since 2012 to date, or to about 2017, we had these conversations with the community, started to tailor what type of services they were looking for. And through that, we grew the Corktown Health Center that you know today. So on the screen, you'll see multiple types of services that we offer at Corktown Health Center, and I'll dive a little bit deeper into that. In 2017, though, about the end of the summer, July, August, we saw our first patients at the center and have been growing at an exponential rate ever since. We are really proud of what we do and the team we have here with us that provide gender affirming care. So our first service we'll talk about today is our clinical services, because that is what was the major pivot in our services back in back in 2017. So with that, we provide infectious disease care, we provide LGBTQ primary care, but of course we do not exclude anyone. So we provide primary care services to anybody, no matter how you identify. We provide breast and cervical cancer screenings, which is great. We provide sexual health services. That includes HIV and STI testing. We have a lovely geriatric service provider that offers services to our seniors periodically, at least once a week. This provider is on site to make sure that they're available to our seniors. We provide, of course, gender affirming care, including hormone therapy. And we have access to all the latest advancements. Just this past week, we were training clients on how to auto-inject themselves with testosterone. So we're always making sure that we are a step ahead of the game as it relates to science and offering our clients and patients the most up-to-date services. We also offer immunizations, of course. And since the beginning of the COVID-19 pandemic, we've been health services to our patients. Our clinic, just so most of you know this, our clinic is comprised of a wonderful interdisciplinary team. We have both nurse practitioners and medical doctors that see clients in our care. Our behavioral health team is a lovely team of LMSWs and limited license MSWs as well that specialize in providing services to marginalized populations. So that would include folks that identify as LGBTQ and those that are HIV positive, those that are living with hepatitis C, anybody that is marginalized. We offer both individual and couples therapy and also support groups for folks. We don't have any support groups running right now, but we are actually on the precipice of launching 2 new support groups. So stay tuned and we'll make sure to share this information with the SRC and share it out to all of you. We provide, again, evidence-based therapy services, of course, and those types of services, clients that we may see may have depression, anxiety, may have trauma, experience trauma or chronic illnesses. And we make sure that clients have really easy access to gender assessments for any type of hormone therapy that they're trying or gender affirming reassignment surgery. Since the beginning of the pandemic, we've also offered behavioral health services via teletherapy. For care management, that's something that it's a term we use internally, but it's definitely something that hopefully other folks know what I'm talking about when I say case management services. We offer a slew of services to all folks that come into our organization, and that includes insurance enrollment assistance for folks that are living with HIV and folks that are not. We also specifically provide early intervention services, which is a term in the HIV community used for folks are newly diagnosed with HIV or lost to care or new to the area. So that could mean folks that have been diagnosed with HIV for some time, but they're new to Michigan or new to the side of the state or whatever it may be. We also offer medical case management services. And really our focus there is to ensure that clients have access to care and treatment for HIV and make sure that their viral load is suppressed. We also offer linkages to other types of providers. So if you're looking for a dentist, you're looking for a nutritionist, you're looking for substance use services, we make sure to connect you to those providers. And our team is uniquely trained to offer assistance to our clients to get the appropriate prescription coverage, which is fantastic. And although we may not do this now because of the pandemic, we've in the past driven clients to appointments, accompanied them on appointments. Now we definitely operate much more in a virtual capacity in that way, but we do offer bus tickets and Lyft transportation rides if clients need a ride to their appointments. Our financial services department has 2 programs, and really all of those programs have to do with providing financial support to clients and patients. These programs are tailored to folks living with HIV. However, we can always provide resources to folks that are not living with HIV that may need a connection to those resources. So our food and nutrition program provides Ryan White eligible or folks that are living with HIV nutritional services, so food vouchers and nutritional supplements. So this could be liquid nutrition like Ensure. And you can also have an appointment with our registered dietitian to have a full nutrition assessment completed. Our Emergency Financial and Housing Assistance Program provides financial assistance to folks that are living with HIV and may be experiencing utility shutoff or eviction, or may need assistance to pay first month's rent for a new home. Our preventive health department is actually a new department at Corktown Health Center. We're really excited about this program as we grow it. Right now, there are three programs that are part of this department. And our first program is our hypertension obesity program, which promotes managing weight and preventing hypertension for folks that are living with HIV. With that program, we offer a slew of services, which is really exciting. We offer some fitness and nutrition program services. So our fitness classes include hustle classes, yoga classes, walking club, a lot of virtual videos that we post on our social media pages. The nutrition classes includes coaching, of course, a DASH diet or a Mediterranean diet you may be more familiar with. Online foods and our videos of food demonstrations, which is really exciting. Our peer support specialist and our registered dietitian go through a bunch of recipes that are really easy and low cost. So you can find those recipes and food demonstrations on our Corktown Health Center social media accounts as well, which is Instagram and Facebook. We also have a new program. It's a food box initiative that we launched in December. And it's a really exciting program where we will actually create a food and a fruit and veggie box and include a recipe that you can actually make with those ingredients and send that to your home. It's a really exciting program, lots of positive feedback about it. So we are going to continue that program at Corktown Health Center. All right, the next program is a tobacco cessation program that we offer to folks living with HIV. And that program is just that. We offer tobacco cessation coaching to help people on their quit journey. We offer counseling, links to support groups. We partner with some of the local organizations to actually host support groups. We help our clients get nicotine replacement therapy and other resources related to general tobacco use or ENDS education. So ENDS being electronic nicotine device systems, so that, e-vaping. And although those two programs, as I mentioned, were aimed at folks living with HIV, we can always provide clients who are not living with HIV resources to other services that exist for clients that are not living with HIV. So please feel free to reach out to us. Our last program in the preventive health department is our HIV prevention program. So this program is tailored to anybody that is not living with HIV, or if you are living with HIV and your partner is not living with HIV and you really want to connect them to some resources, it's a great program for you. And through this program, we offer sexual health education. We offer rapid access to medical care and resources for HIV pre-exposure prophylaxis. So I'm not sure if folks know what that is, but we like to refer to it as in the HIV community as kind of sort of the birth control to HIV. We also connect people to post-exposure prophylaxis if you've recently had an exposure with someone who you weren't sure what their HIV status was. We, of course, provide HIV testing and counseling out in the community at outreach events during Pride, things of that nature. And we just launched this past week a new at-home HIV testing program. So if folks are interested in conducting your own HIV test in the comfort of your own home, we offer that as an option now. You just need to contact our HIV prevention specialist. Information can be found on our Corktown Health Center Facebook or Instagram page. And they will send you out a test to your home, and you can actually make a telehealth appointment with our prevention specialist, and they'll walk you through how to use that kit again, from your couch. We also offer hygiene kits and mail out condom kits to anyone that needs them. Some additional initiatives that we offer here is that I wanted to share with you today is we recently got funded to launch a suicide prevention initiative. And what we are doing is actually using the zero suicide framework and training all of our staff to ensure that they are more equipped to handle clients that may be in crisis. So we're really excited about this initiative. We really want to improve and enhance the work we do every day. And we know that this is important to our clients and the community we serve. And so we have launched this initiative internally. We also, as I mentioned before, have nutrition demonstrations and education sessions. Not only do we have those videos online, but once it is safe again, we will host sessions on site. Prior to the pandemic, we had food demonstrations on site. Clients could have a little bit of a snack to go. We had partnerships with local grocers who sometimes bring fruit and vegetable markets to our site. And that's always something exciting that the clients really enjoy. Again, as I mentioned, we have some new support groups on the horizon. Stay tuned. They're just around the corner. And we have a great partnership with Wayne State School of Medicine. Our medical director actually wears multiple hats and is affiliated with Wayne State School of Medicine. And we have medical students volunteering with our organization. They do everything from help us with blood pressures at events and create content for clients to give away during their visits. Most recently, they created a diabetes packet for clients to review once they know they had that diagnosis, or additional content for folks that may be in that pre-diabetic state. We also have residents rotating through our clinic as well. We also have social work and MPH internships available for folks across the area. We've partnered with both U of M and Wayne State to have and host students and have wonderful internship experiences. Lastly, we would provide all types of trainings and technical assistance, everything from HIV 101s to suicide prevention presentations related to LGBTQ healthcare, technical assistance to some of our local organizations that really want to make sure that they are LGBTQ affirming. And so if any of those are something you're interested in, we can definitely help out in that arena as well. So I've talked about all of our great services, and you're probably wondering, well, how do I connect to everyone? So if you are an administrator and you want to make sure that you're connected to our organization on a higher level and you want to partner regularly, please feel free to reach out to me. I'll have information at the end of the presentation, but we'd love to set up a memorandum of understanding or agreement with your agency. We'd love to make sure that we are promoting cross referrals. If you are an individual providing these services out in the community, please feel free to contact us. We'll make sure we send you our referral form, and you can send it through our confidential fax line, and we'll make sure to connect with the clients that you're trying to connect us with. If you are a client seeking services through us, please feel free to pick up the phone. I'll have the information at the end of the slides here as well. And you can just call us and connect to any of the services I've mentioned before. And with that, I will open it up to any questions we may have. And I'm going to flip through to the next slide so I can keep my contact information up. Thank you.
Thank you so much, Valentina. That was a lot of good information. I do have one question around the services that you all provide to the geriatric community. I know that the clinic is kind of new. I'm not gonna say new, but I just feel like 2020, we bypassed the whole year. And I know that I believe that 2019 opened up your geriatric specific clinic. Can you tell us a little bit more about the services that you provide through that clinic and what your ultimate goals are there?
Yeah, so we have a lot of goals. Some that I can share with you is we have a geriatric service provider that actually comes on site weekly and offers appointments specifically for seniors. Through that, they do multiple senior related assessments. So some related to depression, some related to dementia, some related to physical assessments and cancer screenings. So really, there's multiple assessments that this geriatric provider speaks to, and I can definitely provide you with a list of kind of the run through, but I don't have that with me today. The idea is that, you know, as I mentioned at the beginning of the presentation, the HIV epidemic has changed. Folks are living long, happy, fruitful lives, which is amazing. And so, you know, years ago, we didn't know if we'd be here and caring for folks that are seniors living with HIV. And here we are. And we want to make sure that we're doing it right. We want to make sure that we're addressing things. You know, some of these medications that folks have been on a really long time do impact your body over time. And so we want to make sure that that's being addressed as well, that clients are being carefully monitored. But really trying to make sure that we are doing everything in our power to help people live those happy, healthy lives. And so our team, our case managers work with a lot of our seniors, make sure they connect people, navigate people to additional resources they may need. Some, you know, resources related to retirement communities, some resources related to, you know, caregivers, caring for them, and how we can actually connect those two entities. And so we have a lot of plans to make sure we enhance that piece of our organization. Right now, that's kind of all I can share, but I'm really for what's to come in the future.
Thank you for that. I think I have one more question around, you mentioned that you all had a program that was providing food boxes with recipes, I think it is. Can you
Yes,
give us a
yes.
little bit more information about that? Because you said that it's something that you guys are looking to continue with. So what does that support look like for you moving forward? And who's your partners on this project?
Yeah, so one of our partners is Peaches and Greens, and we love working with them. They've actually had veggies, fruit and veggie stands in our clinic prior to the COVID-19 pandemic, and we've been able to, through some private funds, be able to offer every client in the building on those days access to some fruits and veggies, so no one leaves empty-handed. It's really exciting. Since we haven't been able to provide that, and it's kind of a missing piece, we partnered that kind of initiative and pivoted, right? It's a key word during the pandemic, and thought about ways we could support that type of interaction and intervention with our clients. So specifically for that hypertension, obesity, and HIV program, or the HOH program, we actually call it our Keep It Moving program. One of the interventions that you can participate in if you're in that program is this food box initiative. And so we work with Peaches and Greens and our registered dietitian to come up with a recipe that fits the seasonal fruits and veggies that they're going to put in the box. And it's a really low cost, low budget type of recipe. So even if you don't have access to the program, you can still hear about the recipe and really be able to recreate it at a later date. And we essentially drop off these boxes to people's doorsteps. And we've had such positive feedback. You know, it's difficult for folks to participate in some of our other interventions because they're virtual or some in person, but now it's cold, so we haven't been able to offer them in person. But this intervention, folks are loving, and who doesn't love to eat, right? Yeah, I do. So I definitely enjoy that, you know, the outcomes of this intervention. I think it's great. In the past, our registered dietitian has actually partnered with some of the SRC local partners, so Sage Metro Detroit, to host a food demonstration as well. And we actually have an upcoming one later this year. And as soon as that date is announced, we can share that with all of you. But essentially what happens during these partnership kind of food demonstrations is we use the items that are in these Sage food boxes and come up with a recipe, and with all the items in the box, or most of the items in the box. And the last time what we did is with all the items in the box, we were able to make a chili. That was
Oh, wow.
absolutely delicious. We had a test taste it, of course, at our site, and it was amazing. And then, we demoed that for clients, and it was a hit. So they want to have us back. Sage wants to have us back, and we're happy to partner with them to do that.
Nice. And just to piggyback on that, can you tell us a little bit more about your partnership with Sage and what Sage is? Because they are an amazing resource in the community.
Yes, yes. Sage has been working with us for quite some time. This even predates me working here at Corktown Health Center, and they're a great partner with us. We've been working with them a lot on our senior initiatives, and we have been partnering with them to make sure that partnering organizations that may not be as familiar to work with folks that identify as LGBTQ and are also seniors. We're making sure that they get technical assistance and training, and Sage offers that. They also offer a friendly caller program for folks that are seniors that identify as LGBTQ and that just need a companion or someone to contact them. And it's such a great resource for our senior population that are all too often isolated from others, even prior to the pandemic. They're doing so many amazing things. I hope I capture some of them, but they also have the food box program, as I mentioned, where clients can receive, senior clients can receive food box. There's very little eligibility criteria to meet for that. And we actually house those food boxes, so we partner with them to make sure that those deliveries happen with some of our volunteers.
Yeah, Sage is definitely a wonderful resource. I want to thank you today, Valentina. And I just want to say this. If you guys have not been down to the Corktown Health Center, it is an absolutely beautiful, beautiful facility located in the heart of Detroit. I'm going to say downtown because it's right near downtown, right near the bus station, right near the post office for those Detroiters that's out there. So please contact Valentina. If you have any needs or you just want to to learn more information, please find our information here. You see it on our screen. You can also go to our website, semisrc.org, to find out more information about all of our organizations that belong to the SRC, to the collaborative. So once again, we want to thank Corktown for our lunch and learn today. Hopefully you guys have learned something good. I know I did. And we will be back with you again next month with another lunch and learn. Thank you. And thank you again, Corktown Health Center. Have a great